Hi, this is Bill again. Lecture burst for respiratory and cardiovascular for children. Uh, Developmental stages for the respiratory tract. Um, they, the trachea and esophagus develop around the fourth week of gestation. At 24 weeks of gestation, alveolar cells begin to produce surfactant, important thing to know, which prevents the alveoli from collapsing during respirations after birth. They actually give premature infants that are delivering early, they give the mother in her IV surfactant, and that crosses over the placental barrier and actually helps the baby breathe better once they're delivered. By 35 weeks gestation, the analysis of the amniotic fluid will show that LS ratios helps determine fetal maturity and the ability of the fetus to survive outside the uterus. What is the difference between respiration and ventilation? Most people will think it's the same thing, but it is not. There is a difference. Respiration is the transfer of gases. It could be the transfer of gases from one cell to another, or other transfer of gases. Or ventilation is the body's way of pulling air into the body from the outside of the body and inside and out again. Okay? Disorders and dysfunctions of the respiratory system. There's nasopharyngitis, which is acute coryza, croup syndrome, acute pharyngitis, epiglottitis, and respiratory syncytial virus. Those are the ones that we deal with on a daily basis with children. Um, the croup, there's 6 types of this syndrome. There's a barking cough, inspiratory stridor. Acute spasmodic laryngitis is mild form. Acute laryngotracheal bronchitis is the most common, also referred to as subglottal croup, because edema occurs below the vocal cords. Can lead to airway obstruction, acute respiratory failure, and hypoxia. Acute pharyngitis. Pathophysiology is an inflammation of the structures in the esophagus, common for this age group between 5 and 15. 80% of the infections are related to common viruses. Group A beta hemolytic streptococcus is responsible for about 20%. Treatment, nursing care. Symptoms include fever, malaise, dysphagia, anorexia. Treatment for most cases is related to the symptoms. Group A beta hemolytic strep needs a complete course of penicillin or erythromycin. RSV, respiratory syncytial virus, responsible for 50% of cases of bronchiolitis in infants and young children, most common cause of viral pneumonia. Infants between 2 and 7 months of age can become seriously ill because of their small airways. Spread by direct contact with respiratory secretions, survives for more than 6 hours on the countertop, tissues, and bars of soap. Incubation is about 4 days. If hospitalized, the child is placed into contact isolation precautions. Here are some things for acute laryngotracheal bronchitis. Croup, look at the film, look at the picture, and it will tell you what it is and what happens to it, okay? Epiglottitis, which is air raid, airway closed, increased pulse, restlessness, retraction, anxiety, increased inspiratory stridor, and drooling, excessive drooling. That right there, you look at that picture and that'll tell you a lot about it. Respiratory syncytial virus, RSV, responsible for 50% of the cases of bronchiolitis in infants and young children. Most common cause of viral pneumonia, like I said, spread by direct contact. Incubation time is about 4 days. Okay? And there's a picture of what happens with RSV. Okay? Asthma in children. Acute spasms of the bronchioles caused by a hypersensitivity or a trigger. Signs and symptoms: dry, hacky cough, wheezing, respirations, and difficulty breathing. Intermittent or chronic. Diagnosis made by history and physical examination. Listen to the breathing. Wheezing in all fields with mucus production. Pulmonary function tests and indicate the amount of obstruction that has occurred. All right, cystic fibrosis. Both biological parents have to be carriers of the gene and are Caucasian ethnicity. Early manifestations include wheezing, rhonchi, dry productive cough, increased involvement of dyspnea, proximal, sudden onset cough, advanced disease, cyanosis, pneumothorax, barrel chest, clubbing of the fingers and toes, multiple episodes of bronchitis and bronchial pneumonia. Gastrointestinal findings: large frothy stools, bulky, greasy, foul-smelling, that's called streeturia, voracious appetite, failure to gain weight, delayed growth pattern, rectal prolapse, and anemia. Integumentary findings: sweat, tears, and saliva have an increasingly high content of salt. Endocrine and reproductive findings: viscous cervical mucus, decreased or absent sperm, delayed puberty in females. And very seldom do somebody with cystic fibrosis actually go through and have a healthy lifespan. In major causes of chronic pulmonary disease, it occurs in 1 in 3,000 live births. It's a genetic disease, chromosome number 7, endocrine gland dysfunction, and that. So look at it, know it, love it. You'll get used to seeing it. All right. Sudden infant death syndrome, SIDS, clinically defined as a sudden unexpected death of a apparently healthy infant between 2 weeks and 1 year of age. After 1 year of age, the sudden infant death syndrome sort of goes away and doesn't produce any problems anymore. Clinical features of the disease remains constant. Death occurs during sleep. Infant does not cry or make other sounds of distress. Thought to be caused by a brainstem or abnormality related to the cardiorespiratory control center, overheating, irregular respiratory pattern, decreased arousal response are contributing factors. After the baby is born, you want to make sure that they do not fall asleep with your baby in your bed. If you breastfeed, be sure to place baby back in its own crib before dropping off. Do not allow the baby to sleep with other children. Babies should never bed share with children or adults. You don't want to have anything in the crib but a blanket, and that's about it. If you're concerned about them Being cold, dress them warmly. Offer your baby a pacifier. For breastfeeding mothers, and introduce the pacifier after the baby has learned to feed. Do not attach the pacifier to the baby or crib, since it can be a source of choking. Signs related to the suspected cardiac pathology is failure to thrive or poor weight gain, cyanosis, pallor, visually observed pulsation in the neck veins, tachypnea, dyspnea, irregular pulse rate, clubbing of the fingers, fatigue during feeding or activity, excessive perspiration, especially over the forehead. Okay? So, on to the cardiovascular system. Normal flow of the heart. Blood comes in the right side of the heart from the body through the inferior and superior vena cava. Remember that? We taught you in Intro to Med-Surg. Into the right atrium, through the tricuspid valve, into the right ventricle, and then out to the lungs, through the pulmonary valve, through the pulmonary arteries, to the lungs, exchange of CO2 and O2. Then they come back to the heart through the pulmonary veins, to the left side of the heart, to the right, to the left atrium, through the mitral valve, into the left ventricle, and then is pushed through the aortic valve and to the body and the aortic arch. Congenital heart disease, approximately 8 out of 1,000 births. 50% of infants show signs and symptoms within the first year of life. Of the congenital abnormalities, heart defects are the principal cause of death during the first year of life. Diagnostic studies vary from non-invasive, such as the electrocardiogram, to invasive, such as angiograms. Once diagnosis is confirmed, most cardiac defects require surgical interventions. There's two classifications, two categories, cyanotic and acyanotic. Blood always flows from area of high pressure to the area of low pressure, and it also takes the path of least resistance. Physiologically, defects can be organized into lesions that increase pulmonary blood flow, lesions that obstruct blood flow, and lesions that decrease pulmonary blood flow. A shunt refers to the flow of blood through the abnormal opening between two vessels of the heart. Okay? Defects that increase pulmonary blood flow is atrial septal defect, ASD, an abnormal opening between the right and left atrium in the heart, allowing blood flow from one side to the other to cross over. Then you have the ventricular septal defect, VSD, most common heart anomaly, abnormal opening between the right and left ventricle of the heart, allows blood flow to cross over, has a harsh murmur and thrill that can be noted. And then you have the patent ductus arteriosus. That's where the patent ductus does not close after delivery and stays open and mixes. Since the left side of the heart is a higher pressure system, they both are a left to right shunt of blood. Then you have tautology of Flott, 4 defects, stenosis or narrowing of the pulmonary arteries, decreased blood flow to the lungs, and then a hypertrophy of the right ventricle enlarges because of makes it harder to work against with going through the stenosis or narrowing of the pulmonary artery. Dextroposition of the aorta. The aorta is displaced to the right and blood from both ventricles enter it. And then there's the ventral septal defect. Cyanosis increases with age, clubbing of the fingers and toes due to chronic hypoxia. Child rests in a squatting position. They're like the catcher in baseball. They squat. Prevalent symptoms include feeding problems, failure to thrive, frequent respiratory infection, severe dyspnea on exertion. Polycythemia develops to compensate for the lack of oxygen, and known as Tret spells occurs during the first 2 years of life. Spontaneous cyanosis, respiratory distress, weakness, and syncope occur. They can last up to a few hours and are followed by lethargy and sleep. Place the child in a knee-chest position when the Tet spell occurs. So this gives you a picture of the tautology of flow, Fallot, as they call it. So you can look at that and see what it does. All right. Rheumatic fever, systemic disease involving the joints, heart, central nervous system, skin, and subcutaneous tissue. Belongs to a group of disorders known as collagen diseases. Common features is destruction of connective tissue, scars, mitral valve in the heart. Peak incidence is between 5 and 15 years of age, more prevalent in the winter and spring. Autoimmune disease occurs as a complication of a untreated group A beta hemolytic streptococcus infection of the throat. Major criteria: carditis, polyarthritis, erythema marginatum, chorea, subcutaneous nodules. Minor criteria: fever and arthralgia, previous history of rheumatic heart disease, elevated erythrocyte sedimentary rate, leukocytosis, altered PR interval on an electrocardiogram, and positive C-reactive protein. Okay. The presence of two major or one major and two minor, plus a history of streptococcal infection, is how it is diagnosed. Okay. Kawasaki's disease is also known as mucocutaneous lymph node syndrome, leading cause of acquired cardiovascular disease in the United States. Usually affects children under the age of 5. May be a reaction to toxins produced by previous infections with an organism such as Staphylococcus. Not spread from person to person. Diagnosis is made by clinical signs and symptoms. No specific laboratory test. KD causes inflammation of the vessels of the cardiovascular system, weakens the walls of the vessels, often resulting in aneurysms and abnormal dilatation of the walls of blood vessels. Aneurysms can cause thrombi, blood clots to form, which can be life-threatening. Manifestations usually is abrupt, sustained fever of 104 or 40 degrees Celsius. Does not respond to antipyretics or antibiotics. Fever lasts for more than 5 days. Have fissured lips and a strawberry tongue. Their tongue looks like a strawberry. Treatment for Kawasaki's disease is IV gamma globulin. If given early, can prevent the development of coronary artery pathology. Aspirin therapy for antithrombus properties. I know I said that with Reye's syndrome, you don't give children under the age of 18 aspirin, but in this case, that is one of the things that they do. Warfarin therapy may be prescribed if aneurysms are detected. Nursing care, symptomatic and supportive parent teaching should be reinforced concerning need for positive, active, routine immunizations for several months after, and going on from there. Anemias in children. Iron deficiency is one of the most common forms of anemia. Signs of iron deficiency: low body weight, pale mucous membranes, anorexia, and growth retardation. Diagnosis is made through by a hemoglobin of less than 11 grams per deciliter, or a hematocrit less than 33%. Sickle cell anemia is a hereditary disease occurring in African Americans and also people from the Mediterranean. Occurs in about 10% of African Americans, 1 out of 500. RBCs assume a sickle shape. Diagnosis is made by finger stick looking for the hemoglobin S, and that is the sickle shape. They call it the hemoglobin S. Other anemias, there's thalassemia, is an inherited mild to severe anemia in which hemoglobin production is abnormal. There's Cooley's anemia, presence in the childhood, and is the most common. This often occurs in people from the Mediterranean descent also. Hemophilia is one of the oldest known hereditary diseases. The principal factors that are involved are factor 8, 9, and 11. Factor 8 is the most common form known as hemophilia A, and factor 9 is hemophilia B, also known as Christmas disease. And it is named not for the time of year, but because the guy that discovered it, his last name was Christmas. Idiopathic thrombocytopenia purpurea, ITP, usually follows a viral infection. Most common site of bleeding is mucous membranes, hematuria, and epistaxis. Rarely intracranial bleeding is noted. ITP platelets count may be 20,000 per millimeter cubed. Normal is 150 to 300,000 or lower. Acute leukemia is the most common form of cancer in children, accounts for 30% of all cancers in children. Acute lymphoblastic leukemia, ALL, is responsible for about 70% of those. And then acute myelogenous leukemia, AML, is responsible for the rest. AML has a cure rate of 40%. So it's not a real barn burner there. Acute leukemia, like I said, the most common form of cancer for children, accounts for 30% of all children's cancers. Pathophysiology: leukemia is an uncontrolled reproduction of deformed WBCs. Despite intense research, its cause is still unknown. So there's no cure for it. Leukemia treatments. Survival rate is as high as 86%. Some of the drugs that are used for induction phase is vincristine, which is a chemotherapy drug, prednisone, and L-asparaginase during the post-remission phase, which lasts 6 to 8 months. Then there is the maintenance phase, which lasts for 2 to 3 years. Bone marrow transplant is usually recommended after the second remission in children with ALL. Nursing care is to be supportive of the family and the child by preventing the infection, bleeding, reduction of pain, promoting energy conservation, and relieving anxiety. And that is it for this one. Thank you for listening, and be safe, and I'll see you when I see you.